Hello guys and welcome back to the channel. Today we are going into a battle. It is the showdown between two of the most confusing lung conditions in nursing, chronic bronchitis versus emphysema. If you are studying for your NCLEX or if you just want to understand COPD better, you are in the right place. Many students mix these two up. They think, aren't they the same thing? The answer is no. One is blue and one is pink. One is a bloater and one is a puffer. By the end of this video, you will never confuse them again. Let's jump in. First, what makes them family? First, we have to understand why these two are related. Think of them as brothers in the same family. That family is called COPD. What makes them family? They share the same main problem, limited airflow. In both conditions, the air gets stuck. Also, they both cause respiratory acidosis. This means carbon dioxide builds up in the blood, making it acidic. Another sad truth, both conditions are irreversible. Once the damage is done, we cannot fix the lungs completely. And how does this happen? The number one cause for both is smoking. So, remember, same family, same cause, but very different symptoms. Let's look at the mechanics. What is the core problem here? It's simple. The air can't get out. Imagine your lungs are like a balloon. When you have COPD, you can breathe air in just fine. But when you try to breathe out, the air gets trapped. It stays inside. Because old air is trapped, there is no room for fresh air. This makes the lungs get bigger and bigger. We call this hyperinflation. Just think of a balloon that is blown up too much. This is what is happening inside the patient's chest. Okay, let's meet our first character. This is chronic bronchitis. I want you to think of this as a pipe problem. The tubes in the lungs, the bronchioles, are inflamed, but there's a special term you need to know for your exams. It is hyperplasia of the goblet cells. That sounds fancy, but let's make it simple B1 English. It just means the cells that make mucus grow very big. They work too hard. They produce way too much thick mucus. So the airway gets swollen and filled with sticky liquid. It's like a clogged drain. Now we need to do a little bit of math. Don't worry, it's easy. We need to talk about the VQ mismatch. V stands for ventilation or air. In bronchitis, the V is low. Why? Because the mucus is blocking the door. Air cannot get in. Q stands for perfusion or blood flow. In bronchitis, the Q is good. The blood vessels are healthy. The blood arrives at the lungs ready to pick up oxygen. But here's the problem. The blood is there, but the oxygen is not. The ventilation does not match the perfusion. This is a mismatch. This is why the oxygen levels in the blood drop so fast. So, what does this patient look like? We call them the blue bloater. First, they're blue. Because of that VQ mismatch we just talked about, the oxygen in the blood is very low. This turns the skin blue. Second, they're a bloater. This is serious. The low oxygen causes high pressure in the lungs. This hurts the heart. Specifically, it causes right-sided heart failure. In medicine, we call this cor pulmonale. When the right side of the heart fails, fluid gets stuck in the body. The patient gets swollen legs and a big belly. So, blue skin plus body swelling equals the blue bloater. Now, let's switch sides. Meet character number 2, emphysema. Chronic bronchitis was a pipe problem. Emphysema is a sac problem. The damage is in the alveoli, the tiny air sacs at the bottom of the lungs. Here's the key cause. The body tries to fight the smoke, but the inflammation ends up destroying the elastic walls of the air sacs. Instead of many small bouncy balloons, you end up with big floppy bags that can't push air out. They lose their stretch. Let's go back to our math. Is this a mismatch? No. In emphysema, we have a matched defect. Look at the slide. The ventilation, V, is low because the air sacs are broken. They can't exchange gas. But here's the secret. The blood flow, Q, is also low. When the air sacs are destroyed, the blood vessels around them are destroyed too. So, bad air matches bad blood flow. Because it matches, the body can keep the oxygen levels okay for a longer time than in bronchitis. So, what does this patient look like? We call them the pink puffer. They're pink because the body is smart. It tries to compensate. The patient breathes very, very fast to get enough oxygen and blow off the carbon dioxide. Because they work so hard to breathe, their skin stays pink, not blue. They're a puffer. You'll see them using their shoulder muscles to breathe. They puff air out through their lips. Also, because of all that trapped air, their chest looks round, like a barrel. We call this a barrel chest. If you're standing in a hospital room, how do you tell them apart quickly? Look at the cough. For chronic bronchitis, the cough is the main star. It's a productive cough. This means lots of mucus comes up. To be diagnosed, they must have this cough for at least 3 months. For emphysema, the main problem is not the cough, it's shortness of breath. They feel like they're drowning in air. We call this tachypnea, which means fast breathing. Let's review everything in one snapshot. Look at this table. Bronchitis, the problem is the airways and the mucus. It's a VQ mismatch. The patient looks blue and bloated. Emphysema, the problem is the damaged air sacs. It's a matched defect. The patient looks pink and thin with a barrel chest. Bronchitis breathes at a normal speed, but emphysema breathes very fast. Memorize this table and you will pass your test. Even though they're different, we treat them with similar tools. We use bronchodilators to open the tubes. We use corticosteroids to stop the swelling. You might also see drugs like theophylline or PDE4 inhibitors. The goal is to help the air get out. So, here is your final memory trick for the NCLEX. Blue is for low oxygen. That's the cyanosis. Puffer is for the hard work of breathing. If you can remember blue bloater and pink puffer, you can figure out the rest. Thank you so much for watching. If this helped you, please hit that like button and subscribe for more easy nursing content. See you in the next video.